Fedhealth Medical Aid, nothing's more important than the well-being of your baby and little one, which is why our FlexiFed 2 and 3 plans enrich your pregnancy and parenting experience with benefits like unlimited GP visits, a doula benefit, a private ward for delivery, trauma treatment in a casualty ward, and our free Fedhealth Baby program. To get more choice, flexibility, and control from your growing family's medical aid, call Fedhealth today. Fedhealth, we let you be you.
Hey everyone, welcome to our special broadcast on childbirth classes. And who better to educate our mommies and our daddies than Deryse van Aardt? We've had a podcast with her before, and we brought her back because we want to see her face. We want to see what kind of exercises she can give us to support our pregnancy, and then also our childbirth together with post-pregnancy. Welcome, Deryse.
Thank you, Ilana. I'm loving being here and part of this today. And exercise is my favorite part in getting mom ready for pregnancy and birth.
I must tell you, I'm really nervous today, and it's probably because, first of all, I haven't done a class like this in a while. I'm not pregnant. I wish I was, but I'm really looking forward to what can help us to support our pregnancy. So first of all, who would do these exercises that we're about to tackle?
What I love about the exercises that we've been today is they are tailored around being, for pregnant moms to strengthen the right pelvic floor muscles. So you're going to want to start exercising if you can. Obviously, let's look at the warnings here. You need to get clearance with your healthcare provider. Your healthcare provider is going to know your underlying conditions and whether you can participate in exercise or not. If you've entered into pregnancy pretty fit and doing exercise, you can carry on as normal unless there's any pregnancy-related illnesses or conditions that you might have. Otherwise, moms, start slowly, but it's going to benefit you. It is clinically proven that moms who exercise in pregnancy do have shorter labor, less complications, and post-recovery is going to be far better. And your body's going to look good after birth. So we can use these exercises during pregnancy, and then after baby's born and you've recovered, you can start resuming those exercises once your doctor's giving you the okay, your OBs or midwife's giving you the okay, and resume the exercises and bring your body back into shape.
Now, I love your notes because I've gone through it. I mean, I literally have your file on email. And one of the things that you've said in there is it's good to know your options. I remember preparing for a natural, but then eventually I had a C-section. Literally in a hospital, I went through the 6 pages they had on a C-section because it's the one that I didn't prepare for. How important is it for anyone, no matter which birthing option you choose, to be healthy and be fit? And do the exercises differ for someone that's going to opt for a C-section or someone that's hoping for a natural birth?
Lana, good question. The exercises benefit both moms. We all carrying our babies right up until that 39th, 40th week, and you're still going to have the same strain and ligament aches and back aches as it's irrespective of your birth option. So by strengthening our pelvic floor, by strengthening our lower back and our thighs, we don't suffer with as much backache in pregnancy, and we're fitter as well.
After our last podcast that we had on Baby Brunch, the parenting series, we had quite a few laughs and questions around our question around the perineum. Now, I bet you from your talks, and I know you too well, we're probably going to do something around Kegeling or Kegeling.
All right. Kegeling is fantastic for men and women. All right. So you're going to want to do Kegeling during your pregnancy, and then after baby's born and you recovered, carry on with Kegeling. Kegeling strengthens those vaginal walls. They also strengthen our urethra for men, and that prevents later, reduces the risk of incontinence. But it's getting that muscle getting used to expanding and contracting. So how do we Kegel? Well, there is 2 ways of doing it if you're a lady. Otherwise, you can use your visual. So the first way to understand how Kegeling works is while you're in the middle of doing your urination, stop it in the middle and freeze it and hold it.
So in the middle of a pee, you can stop it, and that's the muscle that you want to work. So you're squeezing essentially a pee that doesn't exist.
But ideally, you never Kegel on a full bladder. So always sort of wait till you've finished and try and Kegel, holding it in for 5 minutes, doing 10 reps of that. And you can incorporate Kegeling throughout, your exercises, your routine. Get in the habit of doing it every day.
If we want to know more about where we can find you for education and for strengthening muscles for childbirth, where can we go?
We've got a Facebook page, Online Childbirth Classes, and it's with Cerebral Bailey Center, which means butterfly in Setswana. Through Cerebral Bailey Center, and they're welcome to come in there and drop a question, and we'll gladly answer them.
Tell me a bit about the class that we're about to do.
You're doing a snippet of the class. Classes, depending on each one, structures it differently. Obviously, with lockdown, we've been doing online classes, so you look at about 2.5 hours per session.
Wow.
It depends on moms and dads. If there's lots of interaction, etc., it can be a little bit longer. But ideally, you're going to get your whole birth planning classes. And today's class, I'm just taking you inside on some of those pregnancy activities that are just going to help you strengthen up and get that body, that pelvic floor and the whole muscular system working nicely and keeping you strong during pregnancy. However, I don't want you to participate in exercise if you have any underlying condition. If during the exercise you feel dizzy, pain, any cramping, nausea, please just sit down and relax and just continue with the exercise. It's about you being comfortable in the exercise. Posture is very important. Otherwise, exercises are not as effective. Sometimes on an exercise, we'll stop for a moment and make sure the postures are correct for us to engage correctly in that exercise to get the effectiveness of the right muscles working.
What do we need in order to participate today? So I've got my comfortable clothes on. You also said that I need to be close to a mat. What else do I need?
We're going to need a chair without arms.
Okay.
All right.
So Deryse, you also asked for a birthing partner. I've got mine here. Birthing partner, come and say hello.
Hello.
Hi.
How's it going?
Fine, and you?
Very good.
Okay, let's get started. So what's the first thing we're going to do?
So the first stretch we're going to work on is having our legs just a little bit wider than our shoulders.
Right.
All right. And if you see my posture is straight, I put my hands at the back of my hips and then putting my head back and stretching.
Okay.
And it just feels good. Make sure your elbows are not out, that they're in, and just stretch back. And this is such a relief for moms who are pregnant. Get a lovely arch going. All right, and then just breathe. Deep breath through your nose, out through your mouth, and then stand up. How did that feel?
I must tell you, this is even a great stretch for me because I can feel, so I walk with an arched back and it's just great for stretching the back. But you know what else? I remember during pregnancy, I had a sciatic nerve that just wouldn't go, and it was this leg. And now and then it still tenses up. So this also feels nice because I get to keep, it's almost like I get to press this down, right?
Yes. Yeah. So you're going to press in, stretch back, and then while you're doing that, do your deep breathing in through your nose and slow, steady breath and out. And at the same time, visualize any tension in your body just being released in that outward breath as it washes out your body. A wonderful release and stretch for mom. This stretch, I want you to be a little unladylike. We're going to open those legs, make sure you're steady, and we're going to have nice wide legs. And then what you're going to do in this exercise, and make sure, moms, before you do this exercise, that you are on a steady chair, you're not going to fall over and rock. So you do want to be a little bit centered back in it. And this is just to stretch. And what we're going to do is, as we move our hands down to our ankles, we're going to breathe in. And then as we come out, we're going to breathe out. So we're going to slowly move our hands down, touch our toes, hold, and then squeeze your abdomen in as tight as you can. and then slowly up and out. All right, and again. And up.
So I have a question, because at the moment, when I pull my pelvis in, obviously my tummy is not as big as it was when I was pregnant. So when you go down, do you go down all the way, or if baby is in the middle, do you stop halfway?
I can tell you, Ilana, moms love this exercise. They go all the way down, and they love the stretch and pull in their buttocks and in their upper back thighs here. It is wonderful and gives them great back relief. Our next stretch, sitting on the chair, is going to take our right arm, and you're just going to grab the chair sitting back, keep your left arm up, and your right arm goes across your chest, holding onto the back of the chair, and then just swing, and then just feel that nice stretch across your back of your shoulders, and that will relieve any tension. Moms are battling to sleep and then swap sides. Moms are battling to sleep at night. This is and get uncomfortable. This also helps to stretch out those muscles that get knotted and tight during that time, and release. Then my favorite stretch with you is using your chair. Posture and doing this exercise is very important, because we're going to keep our feet in line with our shoulders. Our hands are going to be in line with our shoulders as well. And when you do this exercise, make sure that your bottom part of your wrist here rests on the chair. And then you're going to drop your head in between, stretch your hands so that your arms are as stiff as possible. And then in that position, Ilana, you're going to turn your hands out, and you'll feel the pull. So let's put our hands onto resting position, our heads in between our arms, and turn our hands out, and you'll feel it will stretch that lower back. Try to keep your arms as straight and stiff as possible. And aim to have your wrist balancing on the chair. Lovely.
This feels so good. I mean, I'm not carrying a baby, right? But I've just heard my back click. The arm stretch is really good.
No, it really relieves the shoulder tension as well, which is fantastic. We're now going to move into seated squat. You're going to stand up and make sure you've got space that if you fall or anything that you go back. And we're going to just slowly, keeping our arms aligned and our legs, make sure that you are flat-footed, and you're using only your legs, keeping your back straight. You're going to lower yourself into the chair, and then lift up and go back up. And we're going to do, which is a great way for mom to start learning to squat. But make sure you're only using these muscles. So mom's going to aim to do 10 of these per set, and maybe aim to do 3 sets a day. And what's nice is having your birth partner around just to help you with positioning and to help you. But Ian, what you're going to look for is that when Ilana does her squat, that her back is perfectly straight, that she's using her leg and thigh muscles to lower herself down into the chair, and then using those same set of muscles to lift up again, and that she's not using her back to pull herself up and down.
Okay, here we go.
Okay, and keeping your knees out straight, not going outward. Lovely.
It's slow, right, Deryse?
Yes, you're going to do it slow. If you feel short of breath, dizzy, or anything, stop doing the exercise. Or any cramps, just rather not persist with the exercise. Your health and well-being, and baby, who's not there, will also be safe. Okay, and lovely. How did that feel?
Baby and family are happy.
sumo squat, your legs are going to be a bit more apart than your shoulders. Your feet are going to be pointed outwards a bit, not too far. And the idea is not to do the squat that your knees go over your toes. In other words, your knees are showing more than your toes. You're going to do it to your comfort and lower yourself down, hold. And while you're there, I challenge you to a Kegel. Let's Kegel. And one,
this position.
two, let's Kegel. And up.
So how many Kegels in this position?
You're going to hold for 5 seconds. 1, 2, 3, 4, 5. And you should feel the burn in your upper thigh. And then using your thighs, pull yourself up again. So Ian, did she put any strain in her back there when she was coming up?
No, I thought she did really well, especially after the Kegeling. I think we're good.
All right. So let's go one more time.
Right.
And lower it down. And I challenge you to Kegel.
Kegeling.
1, 2, 3. Pull that buttocks in. 4, 5. Up. Well, now I want you after your exercise just to do some deep breathing, just to relax and gather back your breath. So we're going to just our deep squat, we're going to do with a chair. So we're going to turn our chair around. We're going to keep our feet flat on the floor. And we're going to keep our backs perfectly straight. And we're just going to open up, be comfortable, and then relax in that deep squat.
Right.
When a mom is exhausted and she's, been labored a long time, or she needs to slow labor down, or even if she needs baby just to rotate a little bit, sideline in pregnancy, but a mom laying flat on her back to push is not an ideal situation. She's suppressing her aorta, which may leave her feeling nauseous, pallor, lower her blood pressure. So it's not an ideal situation. And historically, we have King of France to thank for that, because he insisted on watching his wife give birth with the entire court and made her lie flat on her back with her legs up in stirrups. And I think it became fashionable after that, because women at that time were using squats and standing positions.
If you had a birthing partner and it's your best friend or it's your husband or your wife, where do they stand at this stage? Do they assist with the squat, or are they?
Ideally, depending on your environment, so with your chair, he might just want to make sure that the chair is firm and steady, that it doesn't collapse over. I've got a very solid chair, so it doesn't fall over with me. But if you're using a plastic chair, hubby's going to want to hold that. But at the same time, if you've got a solid chair, I like dads to just make sure that mom's back is totally straight in going down with the squat, and that you're trying to get a maximum, so your knees are going to be going outwards, not forwards, and we're going to be, our pelvis is here. So going down like that, we're just keeping our pelvis in place. But as soon as we turn those knees outwards, we're starting to open up that pelvis, and it's getting used to opening, expanding and contracting. So you're going to do it to your comfort level, and keep your feet flat.
Flat?
Yeah. Also, it's a wonderful way to learn. There's I think it's a yoga practice. They call it the high knee squat as well, which is really comfortable. And then when you come up, Ilana, you're going to want to use your same muscles that you went down with to come up. Lovely, beautiful squat. Wow. You're making every mom jealous with that squat. Well done. So for this exercise, I'm removing my shoes. I wore colorful socks for you today so that you can spot my feet a mile away. All right. And we're going to move into tailor sitting and tailor presses. So make sure, moms, when you're going down, go down on your knee first, because you are carrying a lot of body weight, and then sit down. And tailor sitting is our normal tailor sitting, where we cross our legs and keep our backs upright. Ideally, a mom-to-be wants to do this most of it, any chance she can get during the day. If you're sitting watching TV at night, I sit cross-legged on the floor. This is wonderful for opening up that inner thigh. And it's very comfortable. Make sure that your posture is 100% correct, that your back is upright. And this is nice. Mom can lean forward, keeping her back straight. Lean forward, hold, and back up. And do some deep breathing. Now, I challenge you again in this leaning forward position to Kegel.
Right, okay. When do you stop doing vigorous exercise? Like, let's say you were a runner, right? So I run, but I've only started running after my babies. So let's say you're a runner or you want to gym or exercise. When do you stop doing that?
Some women go right up until the last 8 months still involved in sport. But those are true sportsmen. So it's something you're going to have to work with your healthcare provider. It's going to be dependent on on you and how the baby is responding in the pregnancy, as well as mom's condition.
Yeah.
We can start pregnancy very healthy, and mom doesn't realize that pregnancy triggers a pregnancy-related condition. So each one has to be assessed for various reasons. You could have fibroids, you could have a low-lying placenta. There's a whole bunch of things. So safely work with your healthcare provider in that. In general, top sportswomen can continue, playing sports up until almost the 8th month if they wanted to.
Right.
Keeping that baby upright, always favoring the upright position is going to help your baby, turn and baby descend into that birth canal when time comes. So that's ideally what we want, is the correct posturing and keeping mom in the upright position. However, if you're suffering from hemorrhoids or piles, there's going to be some relief things you're going to need, certain exercises you wouldn't do because it would put more pressure on the piles, like squats as well. Squats would give you more pressure on the piles as well. So moms should do sits bars there, and or just, just to help them ease that condition off as well.
And I like how you say that, because this is we're testing some of the methods, right? This is not what you would do in a full class. I want to talk about something quickly, because you just brought it up, and I wasn't going to ask you, and I don't mean to catch you off guard, but no one that I've ever met has ever given a solution to hemorrhoids, because it's the one thing that you don't want to talk about, right? Because the baby's putting pressure on the pelvis and things pop out, or boobs become bigger and hips expand. You just mentioned that there's certain exercises that you can't do when there's that kind of pressure. How do you relieve it? What's the other option?
Good relief, sometimes more naturalistic, is in a warm bucket of water or in your bath. Sit for 15 minutes, morning and night, 15 minutes, keeping that water. You don't want to get too hot, because especially if you're in your 3rd trimester, you're more prone to thrush. So you need to just keep that warm, warmish to hotish. Sit there 15-20 minutes, do it twice a day, and you'll see by literally the 3rd day it's eased up. Now that can be the protruding, that can be the itching, that can be the bleeding one, and then post-pregnancy, post-birth, once your doctor's giving you the okay, you can even use something natural like witch hazel and just dab around the anal area just to help give some relief as well. Otherwise, keep up with those warm baths.
Okay.
Because remember, moms, you're carrying a good 8 to 10 kilograms, in front of you. Your coordination's not going to be great. So always go slowly, rather roll into position. Now, the next one is called tailor pressing. So here, we're going to, you see my yellow socks, Ilona, just for you. All right, we're going to have our feet pressed together. Okay, our backs are going to be upright. If you want to, at home, have the wall behind you to do it. Otherwise, if you're comfortable enough. And then you're going to slowly bring those feet in. And we're going to aim to press our knees down. Take a deep breath in, lean slightly forward, and lean a bit more forward, and we're going to stretch out those thighs. And bring those heels a bit closer to your crotch, Ilona. And lean forward over, and you'll feel that nice pull in your inner thigh. And do your deep breathing. And keeping your back straight at all times. Now, pelvic tilt is fantastic. It's strengthening those abdominal muscles. It's working the thigh muscles, it's working the buttocks, and it's a great exercise. It is also wonderful during contraction. If you're having, back labor where you've got a lot of pressure in your lower back, to do a couple of pelvic tilts through some of the contractions, that's going to alleviate some of that back pressure. Also, what's nice is when you're in that pelvic tilt, it just gives baby time. If baby's not in a correct position, the head's turned sideways, just come out the pelvic area for a little bit, the cervix, and just rotate. Turn baby's head left, right, and just center again. So it's a wonderful exercise to use. We strengthen our abdominal muscles and our buttocks and thigh areas, because those are the areas that we work in through labor. And also in the last few weeks of pregnancy, for our C-section moms, this is great to just strengthen that area for you, and it's going to help you in post-recovery, getting your body back into shape and keeping your energy levels up. In the pelvic tilt, I'm going to have my knees aligned with my shoulders. I'm going to have my hands down the sides, but first, because I'm pregnant, I'm going to lower myself on the elbow, lower myself the other elbow, lying down, bringing my feet fairly close to my buttocks. And then what I'm going to do is I'm going to squeeze in my buttocks, squeeze in my pelvis as if I'm doing a thrust. Boom. All right, and tighten my abdomen. And when it's all tight, so I'm going to go boom. Can you see?
I can. So you're not lifting all of it completely. You're just working with your pelvis.
No, we are. I'm just showing you the first part. The first part is bringing it in, and then the second part is pushing up to the ceiling and holding.
Okay.
For one, and keeping your buttocks firm, keeping your abdomen tight, and then hold for 5 seconds, and then slowly keeping everything holding, tightening, and then lower it, and then release. Squeeze in our buttocks, squeeze in and tighten that abdomen. Now push up to the ceiling. Up, up, up. You can go higher. Beautiful. And hold, tighten everything. And now keeping it tight, lower yourself back slowly down to the ground, and then release. How does the release feel afterwards?
Amazing.
All right. Let's do a few of those. Do 2 more. Tighten buttocks, tighten your abdomen, and then pull in and upwards to the ceiling. Hold 1, 2, 3, 4, 5, and slowly lower down, keeping everything tight and in place. And then once your back is on the floor and your buttocks, release. Okay, now roll onto your left side, and you're going to come into the hands and knees position. This is a great position for moms who do, if she's got a lot of lower back pain. It's also she can use this during labor as well. If she's got lower back pain, or even into her second stage of labor, she can use this position to help turn baby. It also will take pressure off her pulse. And also if her labor is going quite rapidly and she's not ready to push yet, she shouldn't be pushing yet. So keeping your hands aligned with your shoulders, your knees apart to your shoulders, and we're going to tighten our abdomen, pull up to the ceiling with head tucked down below, and stretch out those shoulders, and then release the abdomen, and then look up to the sky and arch outwards. Oh, nice, Alana. Well, beautiful. And then pull back in, tightening your buttocks, tightening your abdomen, doing your deep breathing, and then release and head upwards. Beautiful. That's the hands and knees position. Wonderful exercise for moms. So moms are going to want to continue with the pelvic tilts after baby's born. It's going to help tone her tummy as well. So those are the other benefits of keeping up with these exercises after baby's born. What I like about these exercises is that they are mild. Mom can do it to her comfort level. If she feels uncomfortable, she can discontinue with that.
Wow, you're a gem. You know, this is incredible. This is incredible. I think for us to have done exercises, you had to join a Pilates studio. It wasn't part of childbirth classes, you know. So things change and it develops and it builds onto, which is amazing. So thanks for this. Yeah. I mean, this is amazing. The stretches are phenomenal.
Yeah, I love moms who have done yoga and Pilates, because yoga and Pilates gives mom that flexibility and that toning. And they do have specific exercises for moms in pregnancy. You would need to always remind your trainer or who you're working with that you are pregnant, you know, how far you are in the pregnancy, because there'll be certain things that you won't do in those exercises. I do promote and encourage moms to get involved in that and have a dedicated program throughout pregnancy. And then they will find, you know, when they come for classes, you know, from the 26th week of pregnancy onwards, that they're already into that groove of the exercises. They can do the tailor sitting, the squatting, and they're just really very flexible in terms of that. And just keep in mind that in the third trimester, mom's hormone called relaxin, which starts softening the muscles and getting the cervix relaxed, moms are a lot more flexible in the third trimester as well. So mom needs to just take that into cognizance in the last stage as well.
I'm just reminded of a sensation that I had while I was pregnant and doing these stretches. My skin is stretching, so it becomes almost itchy. Do you apply anything before exercising? Because I mean, you do stretching different parts of your body and your skin is stretching because we're picking up weight.
In terms of that, each one's different, you know, so you're going to have a different experience. So if anything, I would say always stick to your tissue oils while you're in pregnancy. They do make a difference. I swear I'll get an email saying, no, they don't, you know, there's conflicting, but from what I've seen personally and from the tissue oils that are in the market, there are some fabulous ones that do aid in terms of giving you skin relief as well as helping, you know, reduce the stretch marks, and help afterwards in getting them to go away too. But ideally, you just want to keep your weight into a certain level during pregnancy, you know, and you can pop into Skim or to Clicks. They've all got a weight chart that mom can use, that she can say, all right, look, I started the pregnancy at 75 kilograms. I don't want you know, it wouldn't be healthy for a woman over 75, 85 kilograms to put on 15 kilograms, you know, to rather eat healthy throughout pregnancy, you know, keep up with water, stay away from fizzy drinks, fast foods, and all of that. It's not good for her health, and you know, what we want mom to have a healthy pregnancy. And also I want moms to learn about doing perineum massages from their sort of 32nd week onwards. Perineum massage can be done, you know, depending on the mom, daily or twice a week is just as effective. And in perineum massages, mom is sort of preparing that perineal area, you know, teaching it to expand and contract, and it can reduce the risk of bearing in childbirth.
This was amazing. So, okay, so to find Deryse on Facebook, where do we look again?
Online childbirth classes, or Google, or on Facebook you can look up Saruru Bailey, Center, and it's spelled Serubele.
Well, we are saying thank you, Deryse, for everything. This was a beautiful way of spending time with you. I miss you in my heart, but it's much better spending time with you like this. Thank you.
I had such fun with you, and Ian, thank you very much. Keep up with those Kegels. Until I see you again.